Hello guys, welcome back to my channel MEDICOGYAAN, the final stop for all your medical queries. I hope everyone is good and taking care of themselves. Please subscribe our channel if not done already and press the bell icon button to receive the further notification. So today we'll be discussing a common neurological issue which is known as Restless Leg Syndrome. So friends, let's go and study about the topic in detail. So friends, what is Restless Leg Syndrome? This is a syndrome which was famously discovered by two scientists known by the name of Willis and Eggbom. So these were the scientists who discovered the syndrome. Hence it is also known as Willis-Eggbom syndrome. So what happened in this syndrome is basically it is a lifelong sensory motor neurological disorder in which there is uncontrollable urge to move the legs. In this picture you can see that the patient is not able to sleep properly and is continuously shaking the legs in the night, which may cause sleep deprivement. The symptoms mostly begin at a very young age, but are most of the time diagnosed in the middle or the later part of his age. So now let's go and study the symptoms part of it. In this neurological disorder, known by the name of Restless Leg Syndrome, the patient will have a strong sensation to move the leg. In this picture, you can clearly see this man is not able to sleep properly and describe the sensation as very unpleasant and uncomfortable sensation. Characteristically, the sensation decline with movement or with rubbing of the legs. So this man will say when we try to rub the legs, the sensation will gradually decrease. Most of the time, this condition appears in the night after going to the bed. Because of it, the patient may land up into insomnia as the patient is not able to sleep properly. Now let's have a look at the epidemiology part of it. This syndrome is found in 5 to 15% of the world population, which means it is a common neurological disorder. Along with it, it has a strong genetic predisposition, which says that if your parents have a history of the syndrome, then there are chances that you may also suffer from it. This syndrome is also seen in patients who are pregnant and in patients of end-stage renal disease, in which there is increase in the urea level, which may disturb the dopaminergic pathway leading to this disorder. One of the most common associations of restless leg syndrome is iron deficiency, because iron is a very important cofactor for the production of the dopamine. Increasing the intake of alcohol and caffeine are also associated to cause this restless leg syndrome. So their intake has to be regulated. Now, after studying the epidemiology, let's go into the pathophysiology of this syndrome. So what are the reasons which may cause this syndrome? As we already know, in the brain there are two important structures which are known by the name of thalamus and substantia nigra. These two structures are said to be involved in this syndrome. The dopaminergic pathway in the brain are directly involved in this syndrome. We all know iron deficiency leads to the decrease in the production of tyrosine hydroxylase enzyme, which is directly linked to the dopaminergic pathway, because of which iron deficiency is one of the most common associations with this syndrome. Now, at the end of the discussion, let's have a look at the treatment part of the syndrome. As we've already said, that the consumption of alcohol and the caffeine should be regulated, as high doses of alcohol and caffeine may aggravate the syndrome. Your doctor may also prescribe you certain oral iron preparation in case you are suffering with iron deficiency. As we all know, iron deficiency is directly linked with the syndrome. Other pharmacotherapy include dopaminergic agents such as levodopa-carbidopa combination and dopaminergic agonists such as ropinirole and pramipexole. And if it is painful, your doctor may also prescribe certain antiepileptics such as gabapentin. So thank you friends for watching this short video on one of the common neurological disorder, Restless Leg Syndrome. I hope everyone understood this lecture well. Kindly please subscribe my channel if not done already and press the bell icon button to receive the further notification. Also, do visit us at www.medicogyan.co.in. Kindly stay for my upcoming videos. Thank you.